I'm talking about parasites in this video series, and I wanted to talk about how do you test for it. If you're suspicious that you have it, or you have a long list of complaints and you want to get down to the root of what's causing your complaints, any good doctor wants to get down to the root of what's causing the complaints. Not just, here's some medicine so you'll forget about your complaint, but let's get rid of the cause and have your reason to complain just go away. So that's what we're all shooting for, and it requires a little bit of testing to find out what's going on. So if I'm suspicious of someone having a parasite infection, or another doctor is suspicious of a parasite infection, how do they rule that in or rule it out? Standard care is going to have basically one way to test. That's going to be doing a stool sample. You're going to poop in a bag, and then it's going to be sent off to a laboratory. The laboratory is going to analyze it. It generally does not show up very well with a urine test or a blood test. So it needs to be a stool test, and that, unfortunately, is not done very much. But it needs to be done. So you could do a stool analysis, and they're going to analyze it for evidence of parasites in the stool. And then, if you identify a yes or no, then you can take steps to work on it. The other way, at my office, if I want to try to identify if there might be a parasite, I like to do it with applied kinesiology testing methods. That's a way of getting neurofeedback, brain feedback. You get the results immediately, and you can get a clue about what's going on. And then you can, if you have a clue about what's going on, then you can take some steps towards working on it. So those are the main two ways that I like. There's other ways of diagnosing in the natural medicine world for what areas have stress. You can have eye mapping, iridology. You can have the awesome acupuncture masters who just say, stick out your tongue, and they go, oh, it's your intestines have stress. Or different ways that kind of can identify some body zones that are having some stress. But these ways don't identify what's causing the stress in that body area. For example, iris mapping may pick up that your stomach, your small intestine are irritated and you're having some symptoms, but they don't know, is it a parasite? Is it a yeast? Is it a bacteria overgrowth? What's causing it? So I find those areas are lacking a little bit of specific, what can you do? There's some other ways too, but the main ways that I like are either have your medical doctor order a good stool sample. Say, hey, I need to have a parasite panel. I want to be screened for every possible parasite known to man. Do it for me. They seem a little reluctant to do that, but it should be a test that's done if you have mysterious conditions. And then at my office, I'll do some applied kinesiology testing, or other guys that do applied kinesiology testing will try to check and see if this is present. So those are the two main ways that people like to get some direction for knowing how do you help this person, what do you do for this person. So those are really the two ways that I trust, or I would recommend my mom or dad or somebody that I care about to go have these type of tests run. You can do both. So if this video was helpful to you, please subscribe to the channel, ask me some questions, reach out to me, and I'll do my best to answer any questions you have. People are individual. People can have some different symptoms or questions, or if I missed something, please ask me. I've seen a ton of stuff in my 22 years of practice and would love to reach into my data bank and see if I can remember something that might be helpful for anybody out there. Thanks, guys. I will see you on another video.